Hi, my name is Dr. John Douillard, and welcome to part 2 on our discussion on heartburn. Today, I want to talk to you about acid reflux, gastroesophageal reflux disease, or GERD, when the acid builds up in your stomach and stays there for such a long time and begins to reflux up into the esophagus and cause the irritation of the esophageal lining, burning, acid taste in your mouth, coughing, hoarseness of your voice, wheezing, and even irritated cancerous cells of the esophagus can cause cancer. So it's a very serious condition. Now, in part 1 of this video, an article, I talk in detail about why the acid stays in your stomach and could potentially go up in the first place. That's important to understand that there's a reason why it lingers, and it would not acid reflux unless it was staying unnaturally in your stomach for too long. So please read that, go there, understand that. But now, when the acid lingers in your stomach for a long period of time, what can happen is the stomach lies right underneath your diaphragm. Your diaphragm is a big muscle that crosses your whole rib cage. On the top of your diaphragm is your lungs and your heart. On the bottom hangs all of your digestive organs, and your stomach on the left side hangs right underneath that. Now, the diaphragm, when you breathe, is supposed to move and contract. As you contract and breathe in, the diaphragm contracts, sucks air all the way in, and as you breathe out, it lets all the air out. Now, we breathe 26,000 times a day. We're supposed to breathe completely. The diaphragm is supposed to contract and relax completely 26,000 times a day. That's a lot. But many of us breathe like rabbits, little tiny shallow breaths in and out all day long. The rib cage has another interesting thing called elastic recoil, which squeezes your heart and your lungs 26,000 times a day and makes your rib cage tight and rigid. So if you're breathing like a rabbit 26,000 times a day, the rib cage is squeezing and your diaphragm therefore can't contract and expand as much. The diaphragm becomes a muscle that loses its elasticity. And just like any other muscle, if it's not contracting and expanding the way it was designed, it will lose adequate blood supply. It won't pump the blood in or the waste out as well. And when the muscles don't get blood, they lay down a protective tissue called fibrous tissue. And literally they stick the little muscle fibers together, and you lose elasticity in that rib cage, in the diaphragm. And when the diaphragm is not contracting well, what happens is the stomach can actually begin to adhere or be pulled up or even stick to the upper side of the diaphragm, and it can cause adhesions. If it gets really bad, the lower esophageal sphincter can actually become damaged, and some of the stomach can actually move right through that little sphincter that allows the esophagus to go through the diaphragm into the stomach. There's a little sphincter there right at the diaphragm, and if that sphincter gets tight, then sometimes you can't swallow good. If it gets too tight, then it can pull some of the stomach up, and it can allow acid to reflux up into the esophageal wall. That's called a hiatal hernia. It's a very serious condition. There are surgeries for it, but they're not the most effective ways of treating it. It's a very difficult thing to treat. In some cases, folks have a very severe hiatal hernia. Some folks have a stomach lining that actually just stuck to the underside of the diaphragm and causing the stomach to malfunction and not therefore contract and move the acid and the food out of the stomach the way it should and cause reflux that way. So there's a technique that what we do is we stick our fingers up under the rib cage, and as you breathe, we sort of pull down on that stomach, separating the stomach adhesions that are sticking that stomach to the lower side of that diaphragm. It's a phenomenally important technique to know. You can do it yourself, and I'm going to demonstrate how you can do that yourself here in just a minute. But it's very important also to know, before you just go do that technique, you have to ask the question, why is that acid lingering? Or what's really the cause of that acid reflux in the first place? And I talk about that in the article associated with this video in part 1, in the video for part 1. Please go there, understand that. And I've written and done many videos on this subject. It's critical that we understand these upper digestive dynamics, because not only they are digesting your food well, but they're your main source of detoxification in a toxic world. That becomes critical. So what I'm going to teach you how to do now is a very simple self-technique that you do to yourself to release the stomach that may be adhesed to the diaphragm. And if there's a little bit of hiatal hernia where the stomach lining might be being pulled up through that lower esophageal sphincter, we may be able to pull that down too and relieve some of the heartburn pain. You have absolutely nothing to lose by this technique. It's one of the things that I always suggest to try, because if those adhesions are there, then it's very important to break them up. Also, how important it is for you to breathe. And I wrote a whole book, Body, Mind, and Sport, about nasal breathing exercise and the benefits of using full respiratory capacity in your rib cage to move like levers, massaging your heart and your lungs 26,000 times a day. That is so important when you exercise, that you breathe properly. And doing yoga, sun salutations, side bends, to make sure that that lower rib cage is free, so you can breathe deeply and keep that diaphragm contracting, so you can, of course, breathe well, massage your heart and your lungs well, but also let your stomach hang as opposed to being pulled up and being compromised by a congested or contracted diaphragm, causing indigestion. Okay, thank you for listening, and in just 1 minute we'll come back and demonstrate this technique. Hi, so welcome to our demonstration on our hiatal hernia heartburn self-therapy. Here is where your stomach is, to the left side of my rib cage, right in through here. Diaphragm crosses my whole body. When the diaphragm gets rigid, then the stomach can actually adhere, get pulled up, and even actually reflux, or even it herniate through the lower esophageal sphincter and cause GERD or esophageal reflux, which is a severe problem, or what's called a hiatal hernia. Sometimes this stomach lining can also adhere, the stomach itself can adhere, and that can cause indigestion as well. So our goal here is to actually pull and separate the stomach all across this area, and actually separate the stomach if it's adhered to the lower part of the diaphragmatic wall. A lot of times when you first do this technique, this is all hard and very painful. It's a good sign that there's adhesions there. A couple of days or a week or so of this therapy, that will go away. So when you do this, you're going to breathe deeply in, and as you breathe out, your stomach relaxes, and you drive your fingers up underneath the rib cage the best that you can. And then breathe in again, in and out, and drive in a little bit further. Okay, now what I want to do is I want to start pulling this down away from the diaphragm. So as I breathe in, my rib cage wants to go up, and as I do that, I'm going to pull my fingers down. So as I breathe in, I'm going to pull down. As I breathe in, I'm going to pull down. As I breathe in, I'm going to pull down. As I breathe out, I can dig in and go in a little deeper. Use this hand sometimes to back it up, to push it in a little further. Then as I breathe in, I want to push down against my rib cage, pulling my rib cage, my diaphragm, and my stomach up. I want to actually pull down against that. So as I breathe in, I'm pulling down. As I breathe out, I'm pushing in deeper, trying to get more of that stomach under my fingers, go up under the rib cage the best I can. Once I get a good grip, then I'm going to breathe in and push down with my fingers. So that's the technique. As I breathe in, my rib cage will want to go up, and I'm going to try to pull down on this tissue. And I suggest doing it all across this whole left side of the rib cage, even across the right side, because sometimes this diaphragmatic area can adhese even to the gallbladder, or at least create adhesions in that area that can compromise bile duct flow, and sometimes breaking up adhesions here can increase bile flow and liver function as well. So if you're tense in this whole area, it's basically giving yourself a really good massage. Massage increases blood supply. Blood supply breaks up that fibrous tissue, allows those tissues to become supple again. So once again, rib cage as you breathe in wants to go up, and as you breathe out, it relaxes. When you breathe out and it relaxes, you drive your fingers up and under the rib cage, trying to get as much stomach as you can. As you relax, get up underneath there. As you breathe in, pull down, pushing down on your fingers against resistance, and then relax. Each time you breathe in, you want to pull down. Each time you relax, you can kind of push in further, use the back of your hand to push that hand in, try to get deeper up in between your diaphragm, underneath your rib cage and your stomach, and as you breathe in, pull down against that resistance. Initially, it's very painful. In a couple of days, that pain goes away, and this begins to soften. This is always in conjunction with either work with your primary care doctor, understanding the cause of your heartburn, or your herbal regime, but this is typically never the cause. The reason the acid got here is because something didn't let that acid leave your stomach, and we need to understand that first but this is a technique that can mechanically help increase blood flow and therefore visceral function. Thanks for listening. I'm Dr. John Douillard.